Se oye?
Okay. Okay, I hope that you can hear me. Okay, is there any question over there?
I have two questions, I think mostly for Dr. Elisa Blanco. One is very short one. You didn't mention xylitol as a sweetener. What is your opinion on that? And the second thing is the diet you described, yes? Is the diet who is also used by people who do anti-aging or want to keep healthy for a very long time, happy and healthy above 100 years of age? So what is your comment on this? Two things.
¿Qué edulcorante? Xilitol. Ah, el xilitol.
Sí, el xilitol. Sí, por un lado me ha preguntado.
Yes, I've been asked about this sweetener, xylitol, and the nutritional recommendations for anti-aging therapy. Well, this sweetener you've mentioned, xylitol, this sweetener is also a chemical product. I don't know what type of studies are behind this sweetener or any of the alcohol-related sweeteners. There are people with intolerance to these alcohols. We have xylitol, malitol, sorbitol as well, ending in all alcohol-related, that may produce intestinal irritation because of abusing this type of alcohol-related sweeteners. This is why I don't recommend them. I go for natural sweeteners, especially in those people who might have much more reactivity to the chemicals. And now, in terms of an anti-aging therapy, well, we really must assess every individual, certainly, and the recommendations may be different. For example, the dysbiosis, for example, we should always take this into account in any individual, the status of the gut, and especially we must enhance the antioxidant food rich in omega-3. Usually, when we are in the anti-aging therapy, I recommend dried fruits if there are no weight problems. Certainly take into account the calories. They may be on dried fruits, seeds, whole food, all those types of food that give antioxidants. And we restrict the dairies, usually the fat in the meat, and if we are in anti-aging therapy, I would recommend fish. So these would be the basic recommendations, and afterwards, depending on every individual aspect, we would go into changes in the diet. And please allow me, when talking about nutrition in the anti-aging therapy, many things have been said, and also silly things have been said. It's important to take into account the evidence. It is true that dietary restrictions, the hypocaloric diet, when people are on hypocaloric, when primates are on hypocaloric diets in experiments carried out, hypocaloric diets prolong life. Yes, it's true, but it isn't easy to get in our daily life. It's true that we may recommend that people eat low glycemic food. To control the inflammation is much more important than controlling other factors. And when we are talking about anti-aging, it's important to talk about neurobioprotection and cardioprotection as well, thanks to the diet. So I would go beyond. And I would like to become an elderly person with 2 body organs functioning very well. And don't laugh at me, please. One, the head. I want it to work perfectly well. And the other one is this muscle here on the thigh. You see, at the thigh, because I think that we, in this world, we know what we're talking about. I want to lead an independent life and going to the toilet on my own and deciding where I'm going to sit down and when I'm going to get up. As for the rest, with 90 years old, I wouldn't care that much. This is what you say today, somebody says. I have many, many questions. I'll go through them very quickly. For Dr. Tinao, I want to say this. In the different alternative soft medicine, you've pointed out yoga, Reiki, etc. And I want to tell you that I think that these soft therapies are not medical soft therapies. They are not. The complementary therapies, and especially those introduced into the medical world, are acupuncture, homeopathy, homotoxicology, osteopathy that hasn't been mentioned, natural medicine in terms of phytotherapy, and the rest that was on the slide, I understand, is not into the medical world as such, but would be other types of supporting therapies that may help the patient with sauna and other things that were on your slide. This is my first comment. And another question that has to do with nutrition. This is addressed to Elisa Blasquez. And, well, after listening to you, I would summarize this. No food is bad except in an individual with food intolerance because of her own genetical inheritance, the genes. And the problem comes from the source of the food. Where does this type of food come from? There can be a problem there. And another question, I don't know whether I have enough time to ask all the questions I have on my list. Another question that has to do with bioresonance. I can't remember his name. I'm sorry. I'm Alfredo. Okay. So I wanted to ask you about counterindications and side effects on the part of bioresonance. Please. Well, thank you for your questions, first of all. Well, on the slide, I showed that the idea of soft medicine and hard medicine isn't mine. It belongs to the world of the Catalan oncologist Natalia Eras. It doesn't mean that I agree with her necessarily. We may go into a long debate whether certain practices could be purely medical or could be in the world of paramedical fields. In the integrative medicine, we have physical therapists with a certain training, which is different from the conventional physical therapy. When we have nutritionists with a different vision on the field. We have nurse practitioners with a different view of the practice, and physicians as well. And none of us excludes other practitioners. I mean that if I'm in the orthomolecular field, I may be as well in a cardiac coherence program. And none of the two would be superior to the other, because I think that here we have a summation effect, and here we have the routing of the patient. The pathways followed in the clinic by our patient will improve his health at the end of the day, the chronic pathologies. So I wanted to say that the idea of a soft thing is much more accepted in the Orthodox medicine. And well, we may discuss what is soft, what is hard medicine, but when we adopt a harder philosophy, we will encounter major problems in the legal domain and also in terms of the acceptance of the findings, for example. Actions decided by me. For example, when I ask my patients to use a viscoalbum in the homeopathic therapy, these would be patients with carcinoma. Then I give suggestions, I give ideas, and I have to assess myself. I really go into a careful evaluation of how this viscous album therapy is going to be given to this patient as a support therapy. And instead of giving a hypnotic, giving melatonin instead, and at what dosage, especially after seeing the fluctuations of the EMEA in Spain, in Europe, the European Medical Agency, Medicine Agency. So perhaps we will have to talk about soft and hard indoors, going into a long debate. So these are for a hot debate for sure. Yes, and I want to say that when talking about integrative medicine, when we want to be exhaustive, when we really want to go into the extra mile in order to check what is a complementary therapy and what is not, and if everything goes into the same drawer, yoga, Reiki, and all those treatments, in inverted commas, for me, well, the physicians themselves will be mixed up. The physician will be mixed up. Because if you tell me that the complementary medicine is yoga, Reiki, or a massage session, well, well, I think that I don't accept it. We must be specific. Within integrative medicine, we must be very specific, generally speaking, and throughout the country, in all the colleges of physicians. This is my own opinion, okay? But I don't agree that complementary medicine includes yoga, Reiki, or any other procedure that wouldn't belong as such into the medicine, where we need diagnosis, a foundation, and a treatment, evidence-based treatments. So amongst what we find, you didn't mention manual medicine, osteopathy, manual medicine to me. And also I understand that those areas where we must enhance, well, we may supplement with these other supporting therapies that are not medicine as such, complementary medicine as such. Because otherwise, amongst the different difficulties in getting the message across, the physicians will be mixed up. I understand that everybody gives out her opinion. I understand what you share with me. I value what you share with me. Right now, the corpus of the knowledge of what we have and what there is and what there is not, little by little, interesting publications are coming up. Coming from North America, from Germany, from United Kingdom. Little by little, we will be building this corpus of knowledge. And the new things, the old new things, the old things that are rediscovered will have to find the right place in the whole picture. And I also want to talk about something. I think there's a confusion when we want to say this is medicine, this is not medicine. There's a common confusion. What I've taken out of this meeting is that we have insisted in individualizing the treatment, adapting the medical treatment to the patient, adapting the treatment to each individual according her own sensitivity. And the paper given by Alfredo, and yesterday many of the guest speakers talked about other factors that have to do with the reaction of the different receptors in the body. So we cannot separate from what is the certified medicine from other types of therapies. So I understand that in the context of the integrative medicine, this could be in or this could be out, but anyway, what matters is the individual, the person in front of us, and to help the person in front of us. I only wanted to thank your contribution because it's true that food in itself, well, we need food, we need food intake, but the problem today is the source of this food, these items. I've been talking about chemicals and intoxicants in the food, but certainly all food is healthy. And whenever there isn't any problem of toxicity or environment-induced illnesses, I would suggest to go for a wide variety of food without abusing only meat, only fish, because we don't want to overload our body with any specific overloading of a specific type of food. And now, in relation to the side effects of bioresonance, first thing to say is that we find very few studies. Until recently, we wouldn't find any on Medline, but now we may find up to 8, up to 10. So far, we don't have enough scientific corpus in order to go for well-founded opinions. But what I can say that the side effects, the adverse reactions are minimal. They might appear at the beginning when we are reactivating the drainage system of the body, and it may happen that latent processes be triggered. One individual that is starting a flu process, the symptoms would go up in a very short time after going through bioresonance sessions. And in 2008, we find a paper with 568 clinical cases with no adverse reactions in 568 cases. I've seen myself initial worsening, but only at the beginning of the bioresonance session. And what we read is that they are non-existent, these adverse reactions. Please allow me, because also we may mention the defensive medicine. This is another chapter, medicina defensiva, defensive medicine, to take into account. Yes, unfortunately, yes. So who should not go to that device? First, the pregnant woman. I'd never think of that. If she's pregnant, as soon as I would learn she's pregnant, she wouldn't go into the bioresonance chamber. Well, I don't read anything about it in the papers, but I don't want anybody to pinpoint this is the cause of a teratogenous problem. And pacemakers, those with pacemakers, no way. They wouldn't go into the chamber. Well, and people would say, why not? And where do you read they shouldn't go? I would say, no way. And then certain histologically typed tumors of a certain histology. There are patients that won't tell us about these problems in the first session, and we would learn this in the second session. So we must go through a thorough medical history in order to check out any problems in the past or at present. It's true that many patients in the first sessions will see that they've really worsened, that they are worse off, and this is why we should be cautious in those patients that are highly sensitive. Otherwise, it would be a therapeutic diagnostic process with high safety. And something else I'd like to add. Indeed, there are certain devices, for example, active probes that transmit a high electromagnetic field. For example, and they wouldn't be for those with metallic implants, for those with pacemakers. And the case of the pregnant women, well, this is common sense because, well, there are cases treating of pregnant women that underwent the treatment and without any problem. Dr. Tinao, for me, it was very, very interesting what you said about the tissues in the gut and the tissues in the thyroid gland. Can you tell us more about this? Well, I think that physicians must relearn what we learned at that time at the School of Medicine regarding embryology or biochemistry. When I got interested in integrative medicine, I really had to go back to the biochemistry books, textbooks, in order to relearn and re-study different aspects. So I think that the clinicians have been pushed to go back to the biochemistry textbooks and the physiology textbooks, because at the School of Medicine we only devote 1 year to physiology and the remaining part of the studies to pathologies. So I don't know, perhaps the curricula in the School of Medicine should change in future. So when this comes up, when talking about the Hashimoto disease, I insist we are talking about dysbiosis in the gut. So we wouldn't understand why all of a sudden the patient would have hyperthyroidism caused by drugs after receiving certain doses. So it's all of a sudden you have the light. Either you see it or you don't see it, and you may have an open approach, a more open approach. And from then on, well, as you do, you study, you browse, and you go to Medline, and you rediscover common links as detectives do. And I am not a researcher, but I was doing research into the links between gut and the thyroid, and there is an embryological connection. And I remember a fantastic teacher, professor. I've had magnificent professors throughout my life, and one of them that gave histology lectures. The function gives the shape, gives the form. That's what he said. So it is there where we see, well, this thymus cell, well, this is an gut cell with different poles and the way the different transmembrane receptors work and function and how they participate. And in Valencia, I wondered about the anti-TPO, if the lymphocyte would never get in touch with that pole in terms of the basal membrane. And then we wonder, because many times those that are away from medicine do ask us, because somebody might say, "What's this?" And we would say, "Well, this is a glass," or "This is a cup." And somebody would say one day, "No, no, no, because it's also a flute." And music would be produced, and all of a sudden your mindset changes. So I think that we require all of this and much more when we are in the field of the integrative medicine. This is why I wanted to present the case to check the approach, not so much the outcome. And here we find many, many facets, you know.
Bueno, yo felicitar a los ponentes y
I would like to congratulate the speakers. I have a question on infertility. Infertility, this is for Dr. Diego Jacques. So, of all the cases of infertility that you treated, homeopathy was given practically to all of them also. Sperm count alterations, etc., etc. And you treated them with homeopathy also. Can you tell me what the homeopathic treatments you gave them? Evidently, we should take into account other aspects, but from your experience, can you tell us the most frequently used homeopathic treatments you used? I've seen the program. I think that it is really very interesting. This is the first time I have participated at this congress, and really, I'm from Zaragoza, and I really miss a monographic topic, which is the Leaky Gut Syndrome. Yes, we'll focus on that at the next Congress, Leaky Gut Syndrome. Yes, since you know a great deal about Leaky Gut Syndrome, you have to participate. 60–70% occur in the colon. I have 5 cases that I have treated. They all started with a GI problem, and they all have ORL problem, and they had treatments, homeopathic treatments. The first thing that we have to do, of course, is to focus on the GI problem. So when they improve on their allergy, when their intestinal dysbiosis improves, then we have to look for the balance. So I think that you should include that for the next Congress. So, and Dr. Jacques, your answer, please. What I mentioned before, when I started my career, well, I started as a doctor in medicine, then I did my specialty in gynecology, but I was always been concerned during the years of residency. I went to surgery to learn more, and to anesthesiology to learn more, resuscitation to learn more. And when I did my gynecology specialty, I saw that there's so many other things that I required, that I needed, and I was fortunate to meet a French colleague, expert homeopathy, and I said, "You're not a doctor." He said, "Why? A homeopath." He spoke to me about homeopath. I said, "You weren't a doctor." He wasn't a doctor, and he said that really toxin drainage, if you are unfamiliar with that, that would make the patient's condition worse. So thanks to this French homeopath who opened my eyes, I started learning more. But I agree completely with Jose Tinao, one has to turn back to the base, to basics. One has to return to physiology. One has to know how a cell works, how the cell functions. I have had to learn and learn a great deal from many. I would like to meet Bruce Lipton. Bruce Lipton, what does he say? He says that in the cell, behavior of the cell does not depend on DNA, but on the receptors. I don't know whether Martin, Paul, or Bill Ray agree with that, but this homeopathic approach, I think, is correct. What do we do with homeopathy? I started in Belgium, I worked with Jacqueline Berens, very famous in Belgium. But what I was looking for wasn't fully answered. The importance of the cells. If you have a single cell that joins other cells to serve the whole, this really is what I consider important. We have to have this dialogue with this system. And today, Professor Martin Paul or William Rea, when I listen to them, I remember that they are looking for the same thing. How can we achieve this type of communication, intracellular and extracellular communication with the receptors? The homeopathy that I use in this sense. We have constitutional remedies, but I had the opportunity to meet Jean Emigel, a Swiss, who was trained with Dr. Sim in Geneva. He is familiar with Vol's electrometer. I met him in '98, and it was really fabulous. The homeopathy I use, since I'm a gynecologist and I turned back to endocrinology, I began to study more on micronutrition, microimmunology. Receptors have always fascinated me, and I use patient history, going back, as Helmiga has advocated. And that has allowed me to have this communication dialogue with the system. I use the homeopathic approach to activate a receptor in males, testosterogenic receptor, or other receptors. And with the help of the patient, I am able to go back to identify the cause of the homeopathic disbalance. And I have received my results. I use homeopathy. I was educated in homeopathy. I was trained in homeopathy. I'm not a microimmunotherapist. I trained many in homeopathy, but I want to be simply a doctor and a friend of cells. And that's what I'm striving to achieve. I would like to congratulate all of you. Very excellent presentations you've given. Elisa, the topic that you addressed is really very interesting. As far as I'm concerned, I'm very interested in nutrition. I still have a concern, and I want to make some comments in that regard. When we say that perhaps if a person may have environmental disease, we can institute this or that measure. I have two brothers who smoke, who died of cancer. I have another one who still smokes. And a few years ago, he had a checkup. After the checkup, the doctor said, "You're okay." But he continues to smoke. And I asked him, "When are you going to stop smoking? When they tell you that you have cancer already?" So when are we going to start the measures? When we have environmental disease already? When we have chemical sensitivity? When we have these derangements and alterations? I think that's very important. What we have in common here is the need to be more aware of prevention, to act as soon as possible, to take action as soon as possible. And I agree with you that when you have someone consulting you and they say, well, this is expensive, oh, that's difficult to follow that diet, it's very difficult to get eat only these food substances, etc. Well, I really don't know how to handle the situation. I think it's necessary to emphasize the fact that we should start prevention, take preventive measures. Otherwise, we really don't know when we're going to start that, when we already have a big problem, when a condition already exists. As I tell my brother, when when is he going to stop smoking? When the doctors tell him that he already has cancer? So I think it's necessary to take all of these different factors into account, and cost, I think, can be offset. This problem of cost can be offset if we can explain to the patient that, well, you can save on this and save on that, and what's important is to have the proper diet that you need, instead of having 40 different foodstuffs and perhaps 15 that you really need, would be the most important things to spend your money on. Thank you. I agree with you completely. I think nutrition is preventive medicine. Eating well is where we should start. We should not wait until we're ill. And really, I try to explain that to my patients, that we spend the money very often on things that are not our priorities. And sometimes we forget about our health. And when patients see changes, well, when they leave my office, I can see the expression on their faces. It tells me that, oh God, they'll find it's going to be very difficult to follow that diet. They can't eat this, I can't eat that, and we have to look for alternatives. Well, we also give them new ideas to get substitute, other options, etc. Try to find also the palatability of the food, make them enjoy food, look for different alternatives, and once they start enjoying that diet, well, I'm sure it's easier for them to change. But I agree with you, we should not only speak about taking care of ourselves once the disease is full blown, is fully established. We should take preventive measures. In the end, the degree or level of stress that we can have also when we're very obsessed with what we eat is not ideal either. So we should focus on a diet as healthy as possible, and we get more and more people who start on this preventive measure already. We have cases that make us really think. And I think it's fundamental for us to become aware of the importance of prevention. Just a comment. You mentioned a very important aspect, which is the attitude, demanding attitude, belligerent attitude. We have to describe the benefits that can be derived from these measures to our patients. And I think environmental medicine, there is also something that we must accept, that we have to be belligerent on the political plane. We should make demands also. We should also not become accustomed to not demanding. Doctors in London during this Industrial Revolution, when faced with cholera, and they decided to abandon medicine and become a politician. And in this way, they were able to control the epidemic of cholera. at that time. But you get entering politics. I'm not entering you. I'm not telling you to enter politics. We really don't need that much of a sacrifice. But the environmental situation worldwide is dramatic. It is really dramatic. Ships loaded with toxins, pollutants sink in Somalia, in Egypt. The seas are contaminated. The junk we send from one country to another country, and the junk that we receive from Germany, we send to other less developed countries, and so on and so forth. We have a lot of junk and waste material in our seas. If Jose Maria Hernandez insists that we have to be belligerent, we have to have this attitude, this approach, we should have to demand these changes. It's not going to be easy, but we, in the long run, will have to do that. Because if we do that, our work only on a patient-by-patient basis will never reach all of our patients. I have a question. I think my question still has to do with treatment, bioresonance treatment, bioresonance for diagnosis and treatment. Can you use that for patients that are hypersensitive to EMFs? Yesterday, we saw that there are two different sources of electromagnetic fields. They may be natural or artificial. The natural called geopathy, and the artificial can be high or low frequency. In Mora's diagnostic system, which I described today, refers to the systemic type developed by Professor Cornelissen. Both types are detected. The natural and the artificial types are detected by bioresonance. The Mora equipment offers treatment, symptomological treatment. It has been effective in those that have been exposed to electromagnetic fields of a natural or artificial type. So both can be diagnosed, tested, and treated, both types of EMFs. A question for Dr. Daniel Coyle. Daniel, yes, a question for you. Would you please give your opinion? Would you please give your opinion on the level of autism, whether this has increased, just like hypothyroidism, what level of autism has increased, and what you can ascribe that to? Some believe that that can be ascribable to vaccines, and I don't know really what it can be ascribed to. So I'd like to know your opinion, please.
Thank you. I think you're trying to get me in trouble a little bit. Yeah, I think the evidence will be with us very soon in terms of a definitive controlled study. Martha Herbert from Harvard Medical School, she's a professor of pediatric neurology, is conducting the largest study ever done on the biological aspects of autism. And hopefully in the next year or two we'll have some of those results. She's written a paper called Autism Disorder of the Brain, or Brain Disorder. Disorder affecting the brain, or brain disorder. It's a really good read. I mean, it explains autism very well, but it also explains the failure in medical thought that has led to it. And I think that's something we need to be very careful of, is that we learn from the MCS, the chronic fatigue, the autism. And that lesson, I think, is A, we need to be less toxic, we need to live more appropriately with the world, but B, doctors need to look at the individual that sits in front of them and not categorise them, guideline them, and send them out. And I think that's the big lesson I hope medicine will learn from when we have the answer to autism. My view is that, yes, it does link very directly to toxicity. Over 80% of cases have severe toxicity, and sometimes that causes neurotoxicity, sometimes immunotoxicity. And if you provoke the immune system during that toxic episode, for example, with multiple vaccines, then it makes sense that body's not going to cope with it. So definitely spread out the vaccines and you know, reduce the toxic load, and then protect your children. Yep.
I'd like to ask each of the panel, since it has been stated here that yoga could not be part of medicine, and yet it's the only modality that has been shown to strengthen the autonomic nervous system scientifically. Can you list other modalities, maybe your modalities, that actually has been shown to lift the parasympathetic nervous system?
¿Qué modalidades pueden ayudar a regular el sistema parasimpático? Vale. Sí. ¿Empiezas? Tú mismo. Vale.
Okay, I'll start. Yes, we mentioned yoga before, and therapeutic exercise have been included in the protocol of Western medicine. It has different levels of benefits, among which we have regulation of the parasympathetic and sympathetic nervous systems. Everything that has to do with relaxations, reduction of parasympathetic activity, respiratory exercises will, of course, get this lift. This can help balance this excess of parasympathetic nervous system activity. Simply, I would like to state that yoga is useful, yoga is helpful, but not only yoga, but all of the natural activities that perhaps contradicts the rhythm of life are useful. All mental, emotional therapies are useful, and that is helpful in achieving social, occupational changes in our perception of life. The stress produces all of these derangements, and all of the relaxation methods will help us. I would like to thank, first of all the speakers for their very interesting presentations. This is the first Congress that I have attended, and I assure you I'm very happy with the results of this Congress. 4 years ago, I started using the Bioresonance equipment or system of Mora. I did not know what it measured when I started and what it did, and I was trained this year, and I'm able now to know what it can do and what I am able to achieve. So, Alfredo, could you please, and this Congress focused on MCS also, and you may have patients that are affected not only by environmental pollutants, but also by other factors. So could you explain the importance of bioresonance, its testing, its tests, quantification, what we can achieve with the different tests and with what we can achieve with quantification? How can this be beneficial to our patients?
Pues realmente.
Well, really, Tomas already knows me, and the results that we have achieved are really very interesting. What is interesting with bioresonance is its broad spectrum. We can use that to assess patient. We can determine the level of stress they have, electromagnetic produced, or sensitivity to certain food, excess or deficits of the patient's presence of heavy metals or absence of vitamins, minerals, etc. So we can do an overall testing of the subject. We can do that at level of different organs, and we shall be able to determine the therapeutic priorities. We're looking for the most important problem that that person may have at the moment, and we can prioritize on that. And we have been, we get patients, for instance, with very complex condition, and being able to prioritize on the stresses that person might have, I think is important. Now I'm beginning to learn more about the utility, usefulness of the bioresonance equipment. I think what's important, at least in my case, I see many chronic conditions that affect the locomotor system, rheumatoid arthritis, etc. When I use the bioresonance approach, I see that each one requires a different type of treatment. And in some cases, I had patients that had different needs and had a different problem. So I just wanted to be sure that the results that we get will allow us to be able to prioritize on the treatments. We can get the one that is a patient badly needs to be treated first. We can do a study in fibromyalgia, for instance, in a group that received manual therapy and the other group that was given a manual therapy plus a MORA therapy. We were able to get 70% results, good results in this comparative study. Before we get to the next question, I would like to take this opportunity to answer Professor William Reyes' comment on balance, parasympathetic and sympathetic balance, the lift of the parasympathetic nervous system. I think there was a study early in the year 2000 or late in the 90s, a comparative study on children with atopic dermatitis. One group had conventional treatment, corticosteroids, etc., pomade, in ointments, and the other group, parents of the other group of children were taught how to give them massage. The results of this comparative study showed that the group receiving massage had improved significantly. So I asked myself the following question: what did they do? What did the parents do? Well, the answer is they simply balance the parasympathetic tonus. They simply balance the parasympathetic nervous system, avoid toxins, strengthen the physiological mechanisms of balance. This is what we're doing all the time. And I don't know whether I've answered the question, the previous question before. I use my knowledge of homeopathy to get into this dialogue to achieve this balance for the parasympathetic nervous system, for the sympathetic nervous system. We should get this balance, a balance that we should respect. I would like to thank the speakers. I have a very simple question. What are the environmental risks that we have today? In rank order, what are the three most harmful? And what you believe would be the most harmful in the next 10 years? So could you rank the three most harmful ones and what you consider to be will be the most important ones in the next 10 years? I think Dr. William Rea can give us a better answer. I think he's the person to answer that question.
Common risks are pesticides, natural gas, and formaldehyde, I think. In the future, electromagnetics and wireless and Wi-Fi are going to be the big problem. And so we're going to have to figure ways to do those and handle those things, because regardless of what we want, the governments are going to push the Wi-Fi and the wireless, and therefore it's going to be a big fight, I think.
Sí, y aprovechando.
No, it's always to stay behind the person, a wise person. Let's see, in France they have removed Wi-Fi for some time now. And one of the projects that Vivosana Foundation has is to fight to get the Wi-Fi removed from school. This is one of the projects following the initiative of Jose Maria. We're going to battle for that. We're going to battle against the Wi-Fi in schools. And I would like to have your support for this project. The French have already removed Wi-Fi from the schools, and I do not really understand why we cannot achieve the same thing here. We cannot use costs or economic reasons. I really don't understand why Wi-Fi is being pushed and sold to us as something advantageous, and why it should be present in schools at all.
¿No hay más?
No further questions? Yes, one more. The lobby is really powerful. Lobby of industry is powerful. Wi-Fi has a lobby here. In Spain, it aims to put Wi-Fi in all schools, so we should battle at a political level and lobby against Wi-Fi. Right? Okay, so thank you very much. We've come to the end of our session. Thank you.